Hello, my name is Kyla Chris, and I'll be discussing the relationship between childhood maltreatment, juvenile offending, and recidivism, and the solutions to those problems. The current issue within the juvenile justice system. Currently, there are high rates of offending and recidivism among juveniles. There is a significant relationship between childhood and adolescent maltreatment, offending, and recidivism that is not being addressed by the juvenile justice system. Trauma that is experienced during childhood and adolescence can negatively impact a youth's mental, physical, and emotional well-being well into adulthood. The current services are not based upon an individual's experienced trauma. No programs currently address trauma and how it has a connection to offending and recidivism. A juvenile's trauma needs to be addressed because it is a critical factor in the effectiveness of their rehabilitation. Now I will discuss the current processes within the juvenile justice system in Florida. Currently, during intake, the juveniles are required to complete the DRE assessment. DRE stands for Detention Risk Assessment Instrument. This assessment is only used to determine whether a youth should be detained in a secure detention facility prior to their hearing, placed on a supervised release, or released without any additional supervision. The risk assessment is not used in conjunction with other instruments to determine risk of offending once released and the rehabilitation services that need to be provided. In Florida, youth only see a mental health service provider if they have an official diagnosis of a mental health disorder. Current practices only focus on diagnosing based on the DSM and the severity of those mental health disorders. The first step in improving the juvenile justice system's process for addressing trauma and reducing the risk for recidivism is administering the Childhood and Adolescent Functional Assessment Scale to all juveniles entering the system. This scale is a tool used for determining the juvenile's degree of impairment with behavioral, emotional, psychiatric, or substance use problems. The scale assesses the needs of the youth, problematic behavior, strengths, and goals. It is used by professionals to make decisions regarding youth's level of care and type and level of treatment. It is comprised of multiple subscales to assess daily functioning in areas such as school, behavior towards others, moods, emotions, home, community, substance use, self-harm, thinking problems. This scale can be completed within 10 minutes, and higher scores on the assessment indicate greater impairment in daily functioning. It is designed for ages 5 to 19. Researchers Quiz and Matazzi indicate that there is a significant relationship between the Childhood and Adolescent Functional Assessment Scale and juvenile recidivism. Specifically, worse scales on the assessment correlated to higher risk for reoffending. Therefore, this assessment can be used to determine which resources to provide that will help to reduce the risk for recidivism. There is a significant need in the juvenile justice system to integrate evidence-based trauma-informed practices. The second step in improving the current practices in the juvenile justice system is to introduce mandated trauma-based cognitive behavioral therapy. CBT is the most commonly used intervention to address trauma and trauma symptoms in juveniles, especially juvenile offenders. Consistent trauma-based cognitive therapy was shown successful in reducing trauma symptoms according to a study conducted by Roden. CBT that consists of cognitive, coping skills, relaxation skills, psychoeducation, affective modulation, and trauma processing can significantly reduce self-reported symptoms caused by trauma. In addition to utilizing cognitive behavioral therapy, trauma affect regulation guide for education and therapy should be administered in the form of mandated group sessions. Roden concluded that using the target model is twice as effective in reducing trauma symptoms compared to therapy services without the inclusion of target. There are many positive outcomes associated with implementing the new and improved juvenile justice system processes for juvenile offending, such as they're improving the mental health and well-being of juveniles within the juvenile justice system, reduced rates of juvenile reoffending after release. The skills learned during therapy can guide juveniles well into adulthood. Therefore, this can increase public safety. This also prevents the onset of adult career criminals. This also reduces the likelihood of juveniles becoming violent and serious offenders. Implementing the improved process. During intake, juveniles will be administered the Childhood and Adolescent Functional Assessment Scale. They will also be given mandated cognitive behavioral therapy. The frequency is dependent on functioning and trauma symptoms. There will also be mandated group therapy based on the target model and administered weekly. In this situation, the stakeholders' role is critical. Their role is to provide funds for the interventions that are needed, such as the assessments and the cognitive behavioral therapy, as long as implementing the target model. Also, the role is to provide access to mental health professionals to the juveniles to administer these interventions. In conclusion, properly understanding the relationship between juvenile maltreatment, offending, and recidivism in the juvenile justice system can ensure that funds are granted for the necessary services. Experiencing trauma in childhood and adolescence leads to high risk of juvenile offending and recidivism. The CAFAS assesses recidivism risk. Trauma-based cognitive behavioral therapy reduces trauma symptoms. Therefore, it reduces risk of recidivism. The juvenile justice system should invest in addressing the trauma and its effects on emotions, behaviors, and delinquency.